Basal ganglion is in the loop where it doesn't talk to the lower motor directly. Like cerebellum, it only talk to the higher level, and specifically in case of basal ganglion, it only talk to the brainstem motor control center, for example, rubrospinal, then pontine reticular formation, and the medullary reticular formation, and obviously cortex. It won't talk to the specific like central pattern generator, definitely not like cerebellum. It won't go any lower than that. It doesn't talk to the motor neuron unit. It will be higher up. So that's where it stands. So presentation, clinically their presentation can vary. Obviously, it has got role in motor function. We see sometimes patient will present with motor weakness, their problem with initiation, their problem with coordination. So that motor can occur, but sometimes they can have behavioral symptoms as well. We will see why do they have behavioral symptoms, because basal ganglion, it's not only connected to the motor system, it is connected with the oculomotor system, it is connected with emotional system, it is connected with cognitive aspect. So if we do something, we do it because we love it. Why do we love it? Because we have dopamine release. So that's the cognitive loop. So always, whatever action we are doing, there is always all these loops are coordinated or happening together. And if there is a problem, so that's why we can get problem with all the other aspects. The behavioral abnormality observed in basal ganglion: abulia, apathy, akinesia, amnesia, disinhibition, hemineglect, and affective symptom like depression, etc. Additional neurological deficit includes speech, memory, motor, and sensory abnormality. Sensory abnormalities are not typically seen. Motor abnormality can be seen. So where is basal ganglion? We have already gone through. So it is, do we need to look at the model again? So the basal ganglion is the part of the telencephalon. It is deep inside the telencephalon, and it is, so that's where, if you look at this three-dimensional picture, so it is situated deep. So that's where it is situated. That's where it is situated. It's in the deep in the telencephalon. So when it comes to basal ganglion, there is a very beautiful pattern. So they have got what we call striatum and pallidum. So these are the core structure of basal ganglion: striatum and pallidum. Okay. Striatum include caudate nucleus, putamen, and nucleus accumbens. So these are the striatum. And pallidum is obviously globus pallidus, and we have got ventral pallidum as well. I'll show in the next slide. So this is one of the slides showing the basal ganglion. So this is the lentiform nucleus, which is globus pallidus and putamen together. This is the caudate nucleus. Where does it end? It ends in the amygdala. Okay. So this is a very good view actually. So see, this is the caudate nucleus, head, body, tail. So the caudate nucleus is actually, so this is the caudate nucleus, and then you have got the globus pallidus and putamen. Okay. Now in front of it is the nucleus accumbens, which is part of the striatum. Okay, and then the part of the pallidum is this ventral pallidum. So this is situated almost in the temporal lobe. So these are the two essential parts, striatum, pallidum. And then what is there is you have to get where the dopamine is supplied. So that's coming from the substantia nigra. So this is the core structure, but then it is modulated from outside. So that comes from essentially from substantia nigra, but also the ventral tegmental area. These are all the image. Blood supply wise, most of the basal ganglion is supplied by middle cerebral artery by the lenticulostriate band, but only the head of the caudate nucleus is supplied by anterior cerebral artery. So the anterior cerebral artery only supplies, but most of it, all are from anterior circulation. The head of the caudate nucleus is supplied by anterior cerebral artery, the rest of it from the perforating artery or lenticulostriate artery from the middle cerebral artery. So what are the functions? Functions is the action selection, limb posture, eye movement, operation learning, chunking of the motor movement, non-motor function, and cerebellum and basal ganglion, they do cooperate to do the movement smoothly as well. So in normal situation, basal ganglion keeps you in the state what you are, both in the mind, both in the body. If you are thinking something, you keep on thinking until some attention is brought to other thing. If you are sitting, you are more likely to sit there until unless there is something else brought into attention with change. So this inertia is done by the basal ganglia. And then you have got how they do that, and then they do selection, which is due to direct and indirect pathway. We'll come to that. Now let me just go back to the one important thing, is this loop. Okay, we always associate basal ganglion with body movement, but it is involved in other aspect as well, and that we have understood now. Body movement loop, oculomotor loop. So if we are moving the eyes, that movement also need basal ganglia, and that is called the oculomotor loop. And then we have got the prefrontal loop. So what is the role of prefrontal? Your mind, okay, thinking something. So that's the prefrontal loop, dorsal prefrontal. And then you have got anterior cingulate orbitofrontal, that's the emotional loop. Anything with action, not so. What I want to impress you is not just the body movement, even the eye movement, even your mind movement, even your emotional movement. All these are controlled by basal ganglia. Okay, so even like your body, if you are sitting somewhere, you are more likely to sit in the same place until unless something else happens. Same with your mind, or your emotion will be in the same place until something happens when you can become sad or angry. So that's how the basal ganglion works. Now, as I have said, the cortical input, the striatal area, the pallidum area, and which nucleus in thalamus they go through will differ. So any basal ganglion loop, the information will come from the cortex. Then they will have to pass through striatum. Then they have to pass through pallidum. Then they go via thalamus back to the cortex, for example. So that's the usual loop. And then we have got modulatory influence from, for example, substantia nigra, releasing dopamine. And then there is another nucleus you might know, subthalamic nucleus, which also is important in the pathway. Now see, if it is motor loop, where the information will come from, primary motor, premotor, supplementary motor. This information goes through putamen. Okay, so that is the specific part of the striatum which will it go through. Then it goes through the lateral globus pallidus, internal segment, then ventrolateral and ventroanterior nucleus back to the cortical target. So that's the loop for the body movement. When it comes to the eye movement, again any movement basal ganglion has to be involved. So for oculomotor loop, frontal eye field, supplementary eye field, all this information will go, like either it is in the posterior parietal or prefrontal cortex. It will go to the, instead of putamen, it goes to the caudate body. Then it goes the globus pallidus. In the pallidum, it's globus pallidus, and then mediodorsal and ventroanterior nucleus of thalamus, and then this loop is completed, giving information back to the cortex. The same principle applies for the prefrontal loop, like when you are taking an executive decision. Okay, so that's the prefrontal loop. So it comes from the prefrontal cortex, goes to the anterior caudate nucleus, goes to the globus pallidus, again mediodorsal and ventroanterior nucleus of thalamus, and then the loop is completed. Okay. So for example, if this part is affected, somebody might have problem in making a higher executive, choosing the right program, right answer for the higher executive decision making, because if this loop is damaged. Okay. Similarly, for limbic loop, like emotional loop, it comes from the, apart from the orbitofrontal cortex, cingulate gyrus, which are all part of the limbic cortex, amygdala, hippocampus. It goes to the ventral striatum, that is the nucleus accumbens. Okay, and then ventral pallidum, and then it goes to the back to the thalamic nucleus, specifically mediodorsal, and complete the loop. And that's how your emotion changes. Okay, so that's the loop it always use. Now, the neurotransmitter in striatum always release GABA, as is the pallidum. So they are all GABAergic. So in normal state, this GABAergic neuron, this one always is releasing GABA. Okay, so that's why we maintain status quo normally. The thalamus is being inhibited, so we don't do any movement. We don't do any eye movement until unless there is need. We don't change our emotion until unless is needed, because there is always, it's in the inhibition. Now what happens if the cortex gives information? For example, this is the direct pathway. I'll show you. So the cortex secrete glutamate, so it will stimulate this neuron GABA. So GABA will be released. Then this GABA will act on the pallidum neuron, which is normally secreting GABA. So if they inhibit it, what will happen? So that's why now thalamus will send information, you start to move. So that's the pattern. And in indirect, there is another player. So from here, it secretes the striatum, which is secreting GABA. Okay, but subthalamic nucleus will secrete glutamate. See, it is stimulating the striatal nucleus, which has got GABA. Okay, so what will happen? The GABA will be released. if the GABA is released, what will happen? Inhibited. So no more glutamate is released. Yeah. So if there is no glutamate released, so it will inhibit it. It will remain inhibited. So that's the indirect pathway. So always there is a balance going on between the direct and indirect, and that's how we do a movement. So when you are doing a movement, certain group will need inhibition, certain group will need activation, and that's the loop it is going through. Same happens in mind, same happens in the thought process and in emotion. So that's the key thing about the basal ganglia. You need to know why it is important. So if we look at the function, so when you are doing a movement or any action, if the dopamine is released, for example, in the limbic loop, if that action is rewarded, then excess dopamine is released, and that's why you want to repeat it. If an action which causes negative emotion, then less dopamine is released, that's why you don't like that action anymore. Okay, so that's how, and so in some people, if they are taking drug, that's why they can easily get addicted, whereas other people might not get addicted. So that's one of the reasons for it. Next we'll go to cerebellum. I'm intentionally making it small because I don't want to go